Hi, everybody. Welcome to week 10. And first of all, happy St. Patrick's Day. So, this week, our discussion question has to do with being student oriented. And we all like to think that we're student oriented, but sometimes it's easier to fall back on habits than to truly be student oriented. When I think about being student oriented, the thing I try to keep in the front of my mind is how can the student best learn this information versus how can I best teach this information? And typically, when we talk about being student oriented, we consider all sorts of things: ease of access to the information, cultural barriers, language barriers, all sorts of things like that. But the thing that comes to my mind first is using active learning strategies in the classroom. And one of my favorite ones, as an example, is the unfolding case study. And that is basically when you present some initial information and then you work on what the nurse would do or create a care plan or something like that. And then gradually you keep adding information. So this could take place, for instance, in a patient as they're being evaluated in the ER. This could take place as patients change settings. So you could have ER, inpatient, surgery, rehab, home care. You can incorporate all those types of care. You could use it in mental health as the patient discloses more, gives more information. There's just all sorts of ways an unfolding case study can be used. You can incorporate phases in the nursing process. You can incorporate pathophysiology, pharmacology, psychosocial things, even environmental factors that are impacting. You can include teaching. So that is kind of one of my favorite ones. When I was teaching undergrad, I was teaching in one of my med-surg classes, I was looking at diabetes. And I started out my class, I had assigned readings and things like that. I started out with a bit of a lecture component, and then I set up stations so that the students could implement things. So I had a station where you had to find out the patient's blood sugar and then use a sliding scale to calculate their dose, that sort of thing. I had one where you had to take an order and figure out how to set up an insulin drip and how to change it based on a patient's blood sugar level. I had another station where you actually had to calculate the carbs for a meal and then translate that into a sliding scale for insulin based on carbs. So it was just something where students had to go around to the various stations and just practice in a hands-on way using these things. There are so many different active learning strategies, role playing, oh my gosh, just tons of things you can do. But it all comes back to how can the student best learn the information? And so many times we think the student has to have all this knowledge before they can implement. But students can actually learn through the active learning strategies without having the content first because they're taking in new information and learning and finding new information as they're using the active learning strategy. So many times faculty will tell me I just don't have time to use active learning strategies in my classroom. And active learning strategies are not supposed to be on top of all the time you take teaching. They're supposed to replace part of the teaching. And I don't think all the time people get that understanding. So just throw out a few things there. Okay, so I'm really going to be interested to see how you guys interpret being student-oriented in your nursing education practice. The other thing we do have coming up, our test analysis paper. That's a big one. I really hope you have already kind of written your test and are getting them out to your peers. Remember, 25 questions, multiple choice. You have to write the questions. They have to go to peers, not students. Do not give this to a student. That will really negatively impact your grade. Follow the directions really, really carefully. Read the rubric really, really carefully. I just last week graded this assignment for another section of students taking the class. The biggest problems they had were with creating the test, trying to create test questions that measured cognitive levels, application, and analysis type questions. A lot of them wrote knowledge and comprehension questions, which can certainly include some of those, but that should not be the vast majority of your questions. If your test is already written, don't worry. We're just discussing it. The other thing they had problems with is trying to come up with good distractors because it's a multiple choice quest. You will always struggle with coming up with really good distractors that will identify the unprepared student because all of them have to be plausible. Some students did have problems with the statistics that are required. I am attaching 2 websites, and if I can find some more information, I might attach that also, because you are being asked to calculate a KR20 statistic, among other things like mean, median, bunch of other things. And so that is going to take a little bit of time. I'll try to give you some resources on that, but there's lots of information on the web. You've just got to find the resources that are the most easy. So look at mine, see what you think, and then go from there. The other piece of it is this really is a paper in APA format. You're going to have references. You need to set it up like an APA paper, just like you would anything else that you're turning in. So those were probably the biggest issues that the students had with that assignment. It's a big assignment and it's hard. I get that. I think it is a hard assignment because a lot of you haven't had to do this before. I'm going to try to give you as much feedback as I can, and hopefully it will be a really good learning experience. All right, so looking forward to your responses this week, and see you in the main forum.